And should every patient who's newly diagnosed with mesothelioma be offered surgery?
Again, no.
A lot of the reason that we don't have a standard in mesothelioma other than chemotherapy is it's a rare disease. There are only approximately 3,000 cases a year, and it's actually a minority of patients that are eligible for surgery at all in the first place. And so going to a multidisciplinary program like we have at Penn Medicine is important to try to figure out who and what the best treatment approach would be for each patient. In some patients, their disease is spread to lymph nodes on the other side of their chest or outside of their chest altogether. Those patients would not be good surgical candidates. We talked about certain histologies that surgery would be less beneficial for, particularly the sarcomatoid patients. And then as the latency period of asbestos can be decades, a lot of times patients are at an 80-year-old state that may not be able to tolerate potentially even a lung-sparing surgery. So there's not a standard approach simply because of how rare and how heterogeneous this disease is. But potentially in patients that are of mind to be aggressive, surgery is a good potential treatment option that we offer to patients. And I think this randomized trial will help us answer the extent of is photodynamic therapy helping that. Other people have started to do lung-sparing surgeries over the last decade as well, and the survival with that appears to be better than historically has been achieved with taking out the entire lung. So not only are patients having a better quality of life, they're actually doing better, potentially because they're better able to tolerate other treatments in the future. Since they have a better quality of life, better performance status, if or when their cancer does come back, they're better able to tolerate either more chemotherapy or novel immune therapies.